APSSM is an Asian Pacific Society of Sexual Medicine. Traditionally, this society hasn't been talked much about the surgical treatment of the erectile dysfunction, which some of us are specialized in. I'm one of the few Asian surgeons who specializes in prosthetic surgery. So usually I myself went to the SMSNA or other, so-called Western countries conferences for like Europeans or North Americans. That's usually where I went. So there is a huge demand from the society, I believe. In our eyes, there's a huge demand from the patients who wants surgical treatment of erectile dysfunction. Pills and injection doesn't work, and the surgeons, many of surgeons doesn't even know. Surgeons don't even know that there is this kind of treatment modality exists, so they cannot help those patients. So we think that many of the Asian countries have been developed economically pretty rapidly in the recent days, but medicine, especially for quality of life, hasn't been developed properly to meet the needs. So to make the situation, to help the situation goes better. And again, my ideas are we should focus on physician education and how do we talk about those education is that the best way is conferences like this. Okay, so today was a start of the APSSM meeting, and it was an official meeting. So yesterday I had a Cadaver lab, which was a little unofficial. Those are for the selected surgeons, but today it was for, I'll say, lay public. So general people as well, general urologists as well. So the course was about the penile implant, and especially it was designed to meet the needs of the Asian market. I'll say Asian patients. So when I was first doing the penile implant surgery, not just myself, but many of the trainees or many of the surgeons I've met, when you're doing the, in the first stage of, I would say, infantile or stages of the surgical skills development, what we feel most difficult is that infection prevention. So for my first 100 cases, I felt really stressed with the infection prevention. But after that stage, as I get more confident with the infection prevention, then what I get really I'll say important is patient's penile size, because after all it was for their own satisfaction, for the quality of life surgery. So patient has a right to ask to restore his penile size as well.
Thanks very much.
So this morning, we had a master class about the penile implant while inviting experts around the world. There was Carlo Bertocci from Italy and Chris Love from Australia and Daniel Osmanov from Germany, and my good friend Eric Chung from Australia as well, and Paulo Egidio from Brazil, and myself from Asia. So I can say that we can represent the expert opinion around the world. So the bottom line is that we were talking about our kind of suggestion on the expert opinion of this each and every clinical settings and the clinical situations. We recommend this or that. There was a bottom line summarizing the Thursday's international panel discussion. And other than that, we were presenting one of our most difficult or complicated cases to tell the audience our experiences. So unlike the many other conferences, this morning's this masterclass was a very cozy little room, and we talked about, honestly shared about our experience with the difficult cases. It was a very great teaching, opportunity for the audiences and the panels as well. That's what I believe. As you know, I attend this kind of penile implant meetings frequently, or at least once or twice a year. Most cases, the suggestions we made or the lectures we have are almost all the same. But still, it's not all the same. There is a little more with every single meeting. That's why we attend and we keep checking what's standard of care and what is not, and what there's a new technologies about it. Tiny little bitty things are very important for the result of the surgery. So we confirmed that again. And it was a great moment for me, great time for me, having those talks with my own colleagues. So it's been a month since I've been to the APSSM meeting, and there was several follow-ups given by the APSSM Association and the meeting chair, Chung. So most of the responses were really nice, and I myself also think that our meeting was very successful. After the meeting, what's interesting was that I got inquiries by the several other countries' urologists to hope to visit my practice to see how I do the penile implant surgeries. There has been inquiries from India, two urologists from India, and other from Jordan, Saudi Arabia, and other countries as well. What I think is that these, urologists encouraged to see my field of the surgery is that it reflects the needs of the patients. Thinking about needs of the patients is getting much more toward the quality of life treatment than before, I believe. And in 2 years, after 2 years, wish I could join the APSSM meeting again, and hopefully we could do some live surgeries or a better education program in the meeting as well.